Good afternoon, everyone. Thank you for joining us today for the Hospice Item Set Submission Requirements webinar. My name is Amy Perez, and I will be your host and moderator today. During today's HIS Submission Requirements webinar, we will cover an overview of the Hospice Quality Reporting Program, the Hospice Item Set, the HIS Assessment Submission Requirements, correcting HIS records, case examples, resources available to providers, and we will conclude today's webinar with a wrap-up and question and answer session. Now I would like to introduce today's speakers. Unfortunately, Cindy Masuda, the HQRP coordinator for the Centers for Clinical Standards and Quality, is unable to join us today due to unforeseen circumstances. However, Joan Proctor graciously agreed to present on Cindy's behalf. Therefore, presenting the HIS Submission Requirements webinar today are Joan Proctor and Brenda Karkos. Brenda Karkos is an Associate Nurse Researcher at APT Associates. She is an RN with many years of experience in hospice, oncology, and community health, including as the Director of Hospice. She currently serves on the Board of Directors for the State Hospice Association in Massachusetts and is a member of the Hospice and Palliative Care Nurses Association. Her work at APT is focused on health policy, qualitative fieldwork, and training projects for hospice, oncology, and home health care. Joan Proctor is the National Coordinator for the Home Health Quality Reporting Program. Joan has worked in CMS for over 20 years in various areas on topics including home health and hospice payment policy issues, demonstrations, and physician practitioner claims processing issues. Joan has a Master's of Science in Healthcare Administration from the University of Maryland, University College. In her previous CMS position, Joan was responsible for the development of payment policy changes for home health and hospice, as well as the lead for oversight of the home health group of software. The slide deck contains a reference list of acronyms that will be used throughout today's presentation. Upon completion of this webinar, learners will be able to describe the elements of the HQRP, provide an overview of HIS completion, submission, and reports, differentiate between a modification and the inactivation of an HIS record, describe some patient examples, re. submission, modification, and inactivation, and locate at least 2 helpful resources for successfully completing the HIS. Now for a few housekeeping items to share with you. This webinar is being recorded. It will later be posted to the CMS Hospice Quality Reporting Program Training and Education Library webpage. We will provide you with details on accessing the recording via email when it is available. If you would like to download today's presentation slide deck, click the Presentation Slides button found in the Web Links panel in the lower portion of the screen to access the shared files. The presentation slide deck is also posted to the Hospice Quality Reporting Training, Announcements and Registration webpage in the Download section. If you download the presentation while in the webinar in Adobe Connect, you will need to return to the presentation by clicking the Adobe icon located in the taskbar. Due to the large number of attendees on today's webinar, we are unable to field questions over the phone, but you can submit questions electronically. The phone lines will be on mute for the duration of the presentation, and the audience is in listen-only mode and will only be able to communicate with us by using the Q&A panel to the right of the presentation. If you require technical assistance during this webinar, please let us know by entering your question or concern in the Q&A panel. More Adobe Connect help can be found by clicking on the Help icon in the upper right-hand corner of the screen. You may also ask any content-related questions you may have via the Q&A panel. We will answer as many questions as possible during the Q&A session in today's webinar. Questions not answered today will be distributed to the appropriate help desks and posted to the HQRP Requirements and Best Practices webpage as soon as responses have been drafted. Closed captioning is available during this webinar. You will find the captions located in the panel directly beneath today's hospice presentation. If you're experiencing difficulties in viewing the closed captioning, please click the Closed Caption View button found in the Web Links panel in the lower portion of the screen. Clicking this option will open the closed captioning in another tab in your browser. You may need to disable your pop-up blocker to enable this tab to open. You may also need to reposition your browser window in order to see the captions and the webinar concurrently. During this presentation, we will occasionally engage the audience in polls. The presenter will read the question and possible answers, and the poll will appear in the panel to the lower right. You may have to scroll down to see all answers to the question in the polls panel. To participate, you must simply select your desired response to the question. Now let's try our first poll. In which year did hospices first start HIS data collection for the HQRP? A. 1979, B. 1983, C. 2014, or D. 2020? We'll wait a few more moments as responses come in. And the answer is C. 2014. It's now my pleasure to turn the session over to our presenters. Joan, you may now begin.
Hi, this is Joan Proctor. Thank everyone for joining us today. Give me 1 second here while I pull up my slides. I thank everybody for joining us today, and really want to thank everyone for joining us. This is an opportunity for us to be able to go over the Hospice Quality Reporting Program and the requirements, the submission requirements. If everyone could give me 1 moment here. Sorry. Apologize for the pause. Next slide, please. The Hospice Quality Reporting Program promotes the delivery of person-centered, high-quality, and safe care by hospices. Hospice providers can use Hospice QRP quality reporting data as part of their quality assurance and performance improvement, or QAPI, programs. Consumers can access publicly reported quality information via Hospice Compare. Next slide, please. Currently, we have 2 requirements for the Hospice Quality Reporting Program: HIS data collection and submission, and consumer assessment of healthcare providers and systems hospice survey submission. All Medicare certified hospice providers must comply with these 2 reporting requirements for all patients regardless of payer. Next slide, please. And this is sort of an illustration just to drive that home. The hospice quality reporting, we use this throughout our program just because we think it's a great way of being able to illustrate the connection between the 2 in terms of the Hospice Item Set and the consumer assessment for hospice programs, the satisfaction survey. Next slide, please. And here we've outlined for you another illustration of the hospice quality reporting life cycle. And the periods of time in which in particular, we're highlighting the calendar 2020, the calendar year 2021, and the fiscal year 2022 in terms of how these all 3 play together. The hospice's data collection and submission for HIS and CAHPS for calendar year 2020 is based upon data that is supported between October 1, the APU is in effect from October 1 of 2021 through September 30th of 2022. So year 1, we've got the data and collection and submission. Year 2, we've got the compliance determinations. And fiscal year is the APU that's in effect. Next slide, please. And I believe that Brenda, turn it over to Brenda here.
Hi, this is Brenda. Can you hear me? So thank you, Joan. So I'd like to start off with a brief review of the basics for completing the HIS. So we know that the HIS is an essential part of the HQRP, and here are some of the common questions that we hear about the HIS. Where does the data come from? Who is allowed to complete the HIS? Who makes the determinations? And who's responsible for the accuracy of the data and the completeness of the HIS? So let's go over just a little bit on the HIS completion, and we'll try to answer some of these basic questions. So when it comes to completing the HIS, the data collection consists of selecting responses to individual HIS items in conjunction with the patient assessment activities, or by abstracting the data from the patient's clinical record to complete some of those items. Any hospice staff member, including some trained volunteers, contractors, or affiliates, can complete the HIS and perform this data abstraction that's necessary to submit the data to CMS. The hospice is responsible for being accurate and complete with the information, and it's up to each individual hospice to decide who can accurately complete the HIS data that's in their agency. So in order to complete the HIS, you might use information from a variety of sources. The data can come directly from the clinical care processes as they're being completed by the visiting clinical staff. For example, many hospices have the HIS items embedded right into their electronic health records, or the EHR, and this data can come from there or from the documentation that's found in the notes within the clinical record. The documentation might include the day of the assessment, but also information from visits occurring just before or even just after the actual admission or the target date, as we call it. So in general, you wouldn't be using external sources apart from the clinical record when completing the HIS, such as perhaps something you might have learned when having a conversation with another staff member that might have visited the patient. But there are instances where a provider would consult sources other than the hospice clinical record to complete some of these items. And these can include some of the billing or claims information that would contain information such as the Social Security or the Medicare beneficiary number, the MBI. And HIS records that can be completed on all patients, regardless of their age, the payer, or the location where the services are being provided. In order to ensure accuracy with the HIS, the responses can be selected by the assessing clinician when they're completing their care process, or they can be taken from the information, as we discussed, that's documented in the clinical record or in the notes. If a particular HIS care process, such as screening for shortness of breath, or one of the preference items is not documented, then that process is considered not to have occurred, and the answer should be no. So the HIS records should be submitted even if the patient later revokes hospice, whether in days or even a week, or perhaps within the first 24 hours. The admission and discharge records should still be completed and submitted. And if a patient is discharged before an HIS-related care process, such as maybe the completion of the comprehensive pain assessment, takes place, the hospice should answer no to the gateway question. And on the next slide, you're going to see an example of one of those items. Once the gateway question is answered, you would continue along, or you'd follow the skip patterns. No items should be left blank unless they're directed by the skip patterns themselves. So here's an example of one of these care process items we just talked about. This one is for screening for shortness of breath. The gateway question is whether the patient was screened or not for shortness of breath. And there the answer is yes or no. And if it's no, you'd skip to another question. But if you answer yes, they're asking for the date that the patient was screened. whatever date is in the clinical record. And then the last question here is just asking what the results were. Did the patient have any shortness of breath? Yes or no? Okay, so let's walk through one practice scenario. Here we have Mr. K. While completing Mr. K's HIS admission record, you are unable to find any documentation of screening for shortness of breath. So how would you proceed with completing the item J2030A? Was the patient screened for shortness of breath? So let's walk through some of the coding choices. Would your answer be A, a 0 indicating no and follow the skip pattern outlined by the HIS? Or perhaps B, your answer is 1 indicating yes, because when you call the patient, he confirms that the admitting nurse asked him whether he had any trouble breathing. Or C, you answer yes because you can assume the screening was done. It's a hospice policy to screen all patients for shortness of breath with every nursing visit. Now let's go over the answers. So for this example, you would answer A. J2030A would be 0, indicating no, and you would then follow the skip pattern to proceed to the next questions based on what's outlined in the HIS. And the rationale for this answer is that if a particular process has not been documented, the care process is considered not to have occurred. So now let's just take another polling question, and this one's true or false. Is it true or false? HIS records need to be completed only on Medicare patients. Looks like some answers are still coming in. Okay. Can we broadcast the answer? So this answer is B, false. This is false. HIS records should be fully and accurately completed on all patient admissions, regardless of the payer. So it doesn't matter what the patient's payer source is, whether it's commercial insurance, whether they don't have insurance, or if they're Medicare fee-for-service. The HIS is for all patients receiving hospice services if you're a Medicare certified provider. So now let's move on to HIS submission requirements. So all Medicare certified hospice providers are required to submit both the HIS admission record and the HIS discharge record for all patient admissions. And this is regardless of the payer, the patient's age, or the location where they're receiving services. The HIS data collected includes items that are used to calculate 9 HIS-based quality measures. We're not going to go into detail on those today, but you can find more information on that and the actual measures on the CMS HQRP website. And you would look under the tab Current Measures. So here are some of the important timelines for you to be aware of. The first is the HIS admission and discharge data must be submitted for all patients within 30 days of the event, or what's referred to as the target date. And just because the data is submitted does not mean it's been accepted in the system. And we'll talk more about that later, how you actually verify the acceptance of the data. It is a recommendation that hospices submit data within 7 to 14 days of the target date. And this way you can check your reports and ensure that if you have to resubmit for any reason, it'll be accepted by the 30-day deadline. So to clarify, since this question's come up before, the 14-day completion is a recommendation, and the 30 days is the actual deadline for submission and acceptance of the records. So this 30-day deadline is the most important for compliance. So before your data can be submitted, you'll have to make sure that the HIS data is in the proper electronic format. This is the XML file. And it's important to receive training to ensure that your submissions are in the correct format, contain the correct information, and will be submitted by the KEYS ASAP system. So some agencies have their own software for submission. That's part of their electronic medical record. But other providers can use the Hospice Abstraction Reporting Tool, or what's called the HART software, and it's a free software that's available from CMS. The Hospice Submission User's Guide is an important resource to walk you through this process, and we've included a list of suggested resources and all the links at the end of today's presentation. So now I'd like to turn it over to Joan Proctor from CMS, and she's going to walk us through HIS record submission.
Hi, thanks, Brenda. I hope everyone can hear me a little bit earlier. I understand that there was some difficulty with the speaker I was using. Now that you are ready to submit, let's review how you do this and confirm the acceptance of HIS records. Next slide. Submission validation. After you submit HIS data, the system performs a validation of the data submitted. There are 3 types of validation checks performed by the KEYS ASEP system. They are, first, the fatal file errors, second, the fatal records errors, and the last one is the non-fatal errors or warning. If your data causes any of these, you will be alerted through the report we will talk about in just a minute. Next slide. Okay, first let's go over the fatal file errors. The system validates the file structure. It is checking the file itself against the HIS data submission specifications. If the file, a fatal file error, and doesn't meet the results in a fatal file error and doesn't meet the requirements, it is rejected. Here are some examples of fatal file errors. This could happen if the file is not a zip file, or perhaps the file cannot be read. Any files that are rejected must be corrected and then resubmitted. Next slide, please. Now let's look at the fatal record errors. The next thing that is happening is that each HIS record within the file is checked for fatal record errors. Fatal record errors include, but are not limited to, the 2 following types: out-of-range responses, inconsistent relationships between items. One example of an out-of-range response is if the valid responses for an item are 1, 2, and 3, but the value that was submitted was 6. This will cause a fatal record error. What about the inconsistent relationships between items? An example of this would be something like an inconsistent date pattern. For example, if someone puts the wrong year on the patient's birth date so that it seems to come later than the admission date, this would cause a fatal record error. Next slide, please. So these records with fatal errors will be rejected by the KEYS ASEP system, and the records will not be accepted even if you submitted these on time. These records, rejected records, will not be saved in the KEYS system. So they will need to be corrected and resubmitted to ensure that data are accepted. And of course, as we discussed, they need to be accepted within the 30-day deadline to ensure compliance. Next slide, please. Non-fatal errors or warnings. Warnings and fatal record errors are displayed on the final validation report, or the FVR. A late submission of HIS records will result in a non-fatal error, otherwise known as a warning. These HIS records with warnings or non-fatal errors can still be accepted by the KEYS ASAP system. But if there is a combination of fatal errors and non-fatal errors, those records will be rejected and need to be corrected. If there are only warning messages, this will not cause a record to be rejected by the system. However, even if there are only warning messages, these should also be reviewed to see if the information can be corrected and then resubmitted. Next slide, please. So the KEYS ASAP system will confirm that the submission was received. And you will see a notification like the one on this slide. It will say your submission has been received, and it will include the name of the file that you submitted. But as we mentioned earlier, this submission receipt does not mean they were accepted. The final validation report, the FVR, is the only way to verify that the submitted files were also accepted. Next slide, please. Let's talk more about this final validation report, or FVR. This report provides detailed information about the status of the files you have submitted. The final validation report will verify acceptance or rejection of the HIS records. It suggests that you print and keep a copy of this confirmation, because this is your proof of HIS data acceptance. The FVR, or the final validation report, will detail the fatal errors and any warning messages. This report is auto-generated for each submission and placed in your provider's validation report or VR folder in CASPER. This report is all automatically purged from the validation report folder after 60 days, but it can be user-generated if you need to request it later. Next slide, please. Here's a screenshot of a final validation report. As you can see from the red circles, this was sent in on January 13th, 2020. You can see that both record number 1 and record number 2 were accepted by the system. Okay, next slide, please. The hospice final validation report. Now let's look at a different one. This is like a continuation of the slide. This one was submitted on January 2nd, 2020. This one shows that one record was accepted, but another was actually rejected. This is the one located at the bottom 1/3 of the page. It also shows you that the rejected record is because of a fatal error. The error in red pointing to the left, there's a number 3079, indicating the error, and there is also a message here. The message says that there is an incorrect Medicare Beneficiary Identifier, or MBI, number. The format is invalid, so perhaps a number is missing. That rejected record would need to be corrected and resubmitted. Next slide, please. Okay, this talks about HIS data and the impact on the compliance threshold. The timeliness of HIS data submission has an impact on meeting the compliance threshold that has been set by CMS. Any inaccurate information in the KEYS ASAP system can impact your hospice quality reporting results. We know that hospices must meet the 90% threshold requirement for timely submission to be compliant and to avoid the 2% reduction in their annual payment update. This threshold has been increasing since HIS data collection started in 2014 and is now set at 90%. The graph above shows you the records submitted in calendar year 2019 needed to meet the 90% threshold, and that data will impact your APE for fiscal year 2021. You can see that for future years, like the data submitted this year in 2020, will impact the fiscal year 2022. If there is a reduction in your APU, this will last for the full fiscal year impacted. Next slide, please. And I'll change over here to some other valuable CASPER reports. We have talked about the final validation report, but there are also some other valuable reports in CASPER. Let's review a few of these. Next slide, please. CASPER reports. CASPER has each one of the reports within them has specific functions. To access these reports, you would select the CASPER reporting link on the CMS Keys for Providers webpage. You would locate hospice-specific reports from these two categories in CASPER. 1, Hospice Provider Reports, and 2, the Hospice Quality Reporting Program. The Hospice Provider Reports contains over a dozen reports that can help with tracking admissions and discharges, but also identifying errors and finding more detail in terms of records with the specific errors. The timeliness compliance threshold is also located here. The Hospice Quality provider reports contains over a dozen reports to help with, I just went over that one. Apologize for repeating myself here. And the Hospice Quality Reporting Program reports contain 3 reports, including the Review and Correct report. The CASPER Reporting User's Guide for Hospice Providers link is listed here. It can give you more detail on how to access and use these reports. In the future, all current KEYS functions will be migrated to the new iKeys platform. For hospices, this will occur no sooner than 2021. At that time, the reports will be migrated to iKeys as well. Next slide, please. So here's what you need to know about the changes in going to iKeys. We are switching from the current system, which is called the KEYS. The reports will then migrate to the new iKeys system and will no longer be referred to as CASPER reports. The change will be in effect no sooner than calendar year 2021 for hospice providers. You can expect to see more information as the transition date gets nearer. Next slide, please. One moment here. So what we have here is an overview of reports for hospice public reporting. Here's a graphic that compares the QM reports, the Review and Correct, and the HIS provider review reports. Let's walk through this together so that you can see some of the differences. We will take one category at a time. The name of the report is on the left, and the columns outline some of the distinct characteristics for that report category. So look at the quality measure reports and go across first. The first column is whether it contains a full year of data. This one has a asterisk that says no. This means the report may include a full year of data if requested by the provider. Now, as we go across, we can see that these quality measure reports include both patient stay and hospice level data. These are not affected by the data correction deadlines. The underlying data can be changed, and these can be run on demand. Next slide, please. Let's look more closely at this category of reports in CASPER, the provider preview reports. The purpose of these reports is to give providers the opportunity to preview their HIS quality measure results and CAHPS survey results prior to public display on Hospice Compare. As of March 2018, the Hospice Provider Preview Report survey were made available. There are 2 separate reports automatically stored in your provider's shared folder in CASPER. Hospice providers are encouraged to use these to review their HIS quality measure results and their CAHPS survey results. Prior to each quarterly release of data on the Hospice Compare, hospice providers are given an opportunity to review their results during a 30-day preview period using those provider preview reports. These reports are provided after the freeze date. Because of this, hospices are not able to make changes to the underlying data. Providers need to take action to ensure all data is accurate prior to the freeze date. If hospices fail to make necessary corrections to their HIS date before a specific freeze date, then CMS will base the measure on the data that was in the CMS system at the time that the quality measures are calculated. Next slide, please. Okay, we're talking here about how you might access and use these reports. You can access your reports in CASPER to investigate quality measure results. You might use these to identify opportunities for data correction and to initiate and update your quality improvement strategies. When you review, if determined necessary, submit, modify, or inactivate HIS records in CASPER. You might then want to access the review and correct reports in the following week to verify any updates or corrections. Okay, I think next slide, please. We're going to actually go to a polling question here based upon what we just went through. So, what is the best way to verify that his submission has been accepted into the KEYS ASAP system is the polling question that we have for you. And I'm going to turn over so that the polling can be activated. Okay, it looks like everyone has completed it, and the answer, of course, based on the next slide, here is that you check the final validation report. The best way to verify that his submissions have been accepted into the KEYS ASAP is to check the final validation report. Now I'm going to turn the presentation back over to Brenda. Brenda?
Sure. Thank you. Thank you, Joan. Now we'll talk a little bit about correcting these HIS records, and we'll detail the process for modifying or inactivating these records so that you can make corrections. Okay, the HIS record should be accurate and submitted and accepted into the KEYS ASAP system. We mentioned that inaccurate information in the KEYS ASAP system can affect your hospice quality results. So it's the provider's responsibility to correct any errors that exist in the submitted HIS records. So records that have not been accepted yet into the KEYS ASAP system include the records that have been submitted and those that were rejected, like the example we saw earlier, and those records that haven't been submitted at all. Now those records that have been submitted and rejected can usually be corrected and resubmitted without any special procedures since they were never accepted by the KEYS ASAP system at all. You can submit a correction for any accepted record even if there has already been a submission and acceptance for a subsequent record on that same patient. The process you use for correction will depend on the type of error that you encountered. So let's look at when you should correct the HIS records. There are lots of reasons for inaccuracies in the records, things like transcription errors or data entry errors, and we spoke earlier about errors in the item responses themselves. So if one or more of the data elements in an accepted record is inaccurate, you can and should make corrections to the erroneous record. And we'll talk about how you do that next. So here's how you can make those corrections. There are two processes. The first one is through a modification, and the other way is through an inactivation. And corrections, whether through modification or inactivation, should be made to HIS records containing errors, even if that means the newly completed record after an inactivation would be late. So the date by which providers modify or inactivate HIS records does impact the data that's reported on Hospice Compare. Effective October 1st, 2019, the CMS policy for HIS patient record submission was changed to 24 months from the target date or the event date. This was a change from the previous deadline of 36 months. The policy change applies to any new, modified, or inactivated records. So HIS submission after 24 months from the target date will be rejected. Now let's talk about more detail about the modifications. These modification requests are used to correct HIS records that were accepted into the KEYS ASAP system. They may have been accepted, but for some reason they had some clinical errors or a non-key demographic error. By putting in a modification request, the old record is archived, and this inaccurate HIS record within the KEYS ASAP system is then replaced with the new corrected record. In order to process correctly, the modification request must contain correct values for all of the items, not just those that require correction. So when a modification request is submitted, the CAHPS system will try to find that existing record. And if the system can't find the record, the modification request itself will be rejected, and a fatal error will be reported on your final validation report. So assuming that it does find the record, the system will take the prior erroneous record and it will replace it with the new one, the corrected one, within the keys system. And the prior record will be stored in an archive file. So here are some examples of when you would modify. So you would modify for things like clinical errors in the responses. So whether a patient or responsible party was asked about preference regarding the use of CPR, or whether or not the comprehensive pain assessment was completed or not. And some non-key demographic errors, you might need to correct the site of service at admission. Say the patient was in an assisted living and they weren't in a private home, but that had been put in wrong. The date the initial nursing assessment was initiated could be an error, and perhaps the assessment date was put in wrong by the staff that was doing the data entry. Now let's look at a screenshot for the CPR preference. This one asks whether the patient or the responsible party was asked about the preference for the use of CPR. So was there a discussion, no or yes? And yes, but the patient or the responsible party refused to discuss. So if there was a discussion, what was the date of that discussion? So here's an example of something you might modify. Now we're going to look at the inactivation requests. These must be used when a record has been accepted in the CAHPS system, but either the event did not occur or one or more event or patient identifiers is erroneous. So here's a screenshot of the Social Security and Medicare numbers. For errors like this, you would need to do an inactivation, not a modification. So on this slide, we have a list of some of the identifiers that would require inactivation if there are errors here. So these include the admission date, the reason for the record, the discharge date if it was wrong, and some of the patient identifiers like the first name or last name, a Social Security number error, the gender, or a birth date, for example. So one important note for inactivation requests, the record identifiers or patient identifiers submitted as part of that original record must also be submitted as part of the inactivation request. So in order to inactivate, you pretty much have to complete the paper just the way it was put in so that it can find the record and match those values. And then the erroneous record and the inactivation record will match and it will be inactivated. Then any new information can be resubmitted. And you would do this by replacing the record with a brand new one with all the correct information. So once this inactivation request is submitted, the CAHPS system uses patient identifiers to locate that existing record. And if the system doesn't find the record, the inactivation request will be rejected and a fatal error is reported on your FVR. If the system finds the record, the prior erroneous record will be removed from the active keys records and stored in an archive file within the keys system. If necessary, you would then create and submit a brand new record with the correct information. Now let's go to a quick polling question and then we'll move on to some case examples. So how many months from the target date does the hospice have to complete the HIS patient record submission? Is it A, 30 days, or B, submission must occur on the day of the event? Or is it C, 24 months, or D, 36 months? Okay, why don't we move to the answer? And I see a lot of people answered 30 days, but the actual answer to this question is 24 months from the target date to complete the HIS patient record submission. So yes, in order to meet the Hospice Quality Reporting Program requirements, you have 30 days to get that record submitted and accepted in the system. But in actuality, you have 24 months. You could still put in records. We get questions all the time about hospices that found a record that never got put in. They would still be able to put those records in, although it probably would not impact your quality reporting results, which would have already occurred. But it used to be 36 months that you still could submit a record. At this point, it's now 24 months. Okay, let's go through some case examples and review whether to submit, to modify, or perhaps to inactivate some records. So in this scenario, in auditing HIS submissions, the hospice's QAHPS nurse found an error in the discharge reason on the HIS from Mrs. Jones. The HIS record has already been accepted and submitted and accepted into the system. So does the hospice need to correct this? So do you correct the discharge record for an HIS record that's already been accepted? So it might have been accepted by the 30-day deadline, but you found an error and you want to correct it. So is it A? No, it's not necessary since the patient died months ago. Yes, complete a modification. Yes, and an activation is required. Or is it none of the above? Okay, it looks like the submissions are slowing down. Should we go to the answer? So the answer is B, and it looks like most of you answered B. Yes, you would complete a modification. So again, you still have 24 months that you could still submit a record. You could complete a modification and correct that record. Okay, how about another scenario? Mr. Green. Mr. Green was discharged from the hospital on February 26, 2020. The hospice election paperwork was signed on that day, and when the RN arrived for her visit the next morning, the family was on the phone with their primary care practitioner and notified the nurse that the patient had died. Is an HIS record required? So let's look at the possible answers. I'll ask you to weigh in on this one. So is it yes, because the RN is in the home and she needs to complete the necessary paperwork? Or yes, because the election form was already signed? Or no, the patient died before the RN arrived, so the services were never initiated. This is one that also comes in quite often through the help desk, so this was a question we thought we would include. Looks like a lot of you think it's C. Some of you, quite a few of you still think it's B. Almost split in half between B and C. So let's look at the answer. So in this instance, the answer is C. No, the patient died before the RN arrived, so the services actually were never initiated. So for the purposes of completing the HIS, a patient is considered admitted to a hospice if the following conditions are met. So there is a signed election statement or another agreement for care for non-Medicare patients. The patient did not expire before the effective date, which in this case was true. And the hospice made a visit in the setting where the hospice services were to be initiated. So the RN was there, showed up, but the patient had already died. So all three criteria would need to be met in order for the patient to be considered admitted for the purposes of HIS reporting. So in this case, because the nurse arrived at the home after the patient died, there would be no need to put in an HIS. Okay, so let's just say, what if Mr. Green died while the nurse was in the home in the middle of her assessment? And certainly I'm sure that's happened to some of you hospice folks before. Is an HIS record required? So is a record required in this instance? So it would be yes, all the necessary conditions are met. B would be the hospice cooperating nurse will make the final decision, since I was partly done my assessment, but I didn't finish. Or C, the patient died before the RN assessment was complete. Still have answers coming in. Looks like the bulk of you are answering A, and we still have quite a few people answering C. So let's go to the answer. So in this case, the answer would be yes, A. All the necessary conditions are met. The patient is considered admitted because there was a signed election form. The patient did not expire before the effective date, and the hospice made the visit in the setting where the services were to be initiated, and the patient was still alive when the nurse arrived and started her assessment. So all those criteria would met, and you would still submit an HIS record. Although I imagine there'll be quite a few care processes that weren't completed, so you'd have to answer no to some of those. Now let's look at a different scenario. So Mr. H was admitted to hospice on January 28, 2020. The HIS was submitted on Friday, the 14th of February, and when reviewing charts for the IDG meeting on Thursday, the 20th, the nurse manager finds a note in the chart from the initial hospice consult. It described the patient-family conversation with the hospice liaison about all of his preferences, and this was noted just 2 days prior to the admission. So the nurse manager knows that the hospice submitted the January HIS records on February 18th, and that the submission for this patient did not reflect the completion of care processes that she found in the note. Let's look at this graph and the dates here. On January 26th is when the admission occurred, or no, the admission occurred per the notes. The discussion occurred per the notes, sorry. On the 28th was the actual admission visit, and then the HIS was submitted on February 14th, and we can see that was 17 days from the target or the admission date. So if the note was found on the 20th, we can see that the date is the target date plus 23 days. So there's still time to submit a corrected HIS within that 30-day deadline. Should the nurse manager make a correction, and if so, how should she go about doing that? So let's go to the polling question. So would the answer be A, yes, the record should be corrected by modification, even though it will not change anything? B, yes, the record should be corrected by modification, and it will have an impact on the hospice's quality measure results? Or C, no, it's a lot of trouble to do this, we won't bother? Or D, no, the submission has already been accepted in the KEYS ASAP system. I'll give you time to get your records in. Okay, it looks like most of you have answered B. Let's see what the answer is. And the correct answer is B. The record should be corrected by modification, and it will have an impact on the hospice quality measure results because it's within that 30 days. And again, you can still submit if it was after that for up to 24 months, but if you correct these things before that those quality measure results are completed, then it's going to impact your results. Okay, let's look at another scenario. So when discharging Mrs. S after her death, the nurse noted that the first name of the patient was wrong in her electronic health record. Although the entire family referred to her as Mary, the patient's actual first name was Elizabeth. Mary was her middle name. And what needs to be done to correct this record? Now, I've certainly seen that in my career, that a lot of times people will go by their middle name, and you discover it when you do the pronouncement, that their name is completely different. So how would the hospice respond and correct this record? Would the answer be A, there's no need, just submit the accurate information on discharge? B, a modification of the admission HIS record is needed? Or C, an inactivation of the HIS admission is required. The data includes a patient identifier and the admission HIS has already been accepted by the CAHPS system. And it looks like about 90% of you have answered C, so let's see what the answer is. So in this case, the answer is C. An inactivation of the admission HIS is required. The data has already been accepted by the CAHPS system, so you would need to inactivate the record. And you would want to have the actual name before you put in a discharge record with a different name, for example. So let's take a minute to summarize what we reviewed today, and then we'll go over a few resources and links that you might find helpful to refer to. So today we've described the elements of the HQRP. We provided an overview of the HIS completion, submission, and reports. We differentiated between a modification and an inactivation of an HIS record. We reviewed examples of HIS submission, modification, and inactivation. And we're now going to review a list of helpful resources that will help you to be successful in completing the HIS and complying with the Hospice Quality Reporting Program. So here are some resources you might want to bookmark and refer to often. One is the HIS Manual, version 2.01. Then there's the Hospice Users Guide and Training page on the Keys Technical Support Office website. Then the Hospice Submission Users Guide for help with submissions. And the HQRP Training and Education Library webpage, and all of the links are located here. And some other resources that would be very specific to the CMS HQRP website is the HQRP webpage, the HIS webpage that talks much more about the actual data set, the CMS Hospice CAHPS survey webpage, and then there's the official Hospice CAHPS survey website. And this last resource page is on the multiple help desks that are out there to support providers. And here are some links to those. The first one is the Quality Help Desk. So any questions about the Hospice Quality Reporting Program, the Keys Help Desk to help address questions about HIS submission, reports, and CASPER. Then the CAHPS Hospice Project Survey Team for questions about CAHPS and technical assistance with that. And then last on this page is the link that will bring you to Hospice Compare, so you can see your results and compare that with the national averages. Now let's take some time to answer some of the questions that have come in.
Thank you, Brenda. It's now time for the Q&A section of today's webinar. The presenters were assigned questions as they were received during the presentation. Let's begin reviewing and responding to those questions. So our first question is there any grace period for a newly enrolled hospice provider in the submission of HIS data? And Joan, can you provide a response to that question?
For a newly enrolled hospice provider, we do have some provisions. I'm going to turn it over here to Brenda for a second because I don't think I have access to the responses. Give me 1 second here. Brenda, can you help me out here?
Sure. Yeah, I can take this one. So in terms of a grace period, there are two considerations for new providers to keep in mind with respect to HIS reporting. The first is when providers should begin reporting HIS data. And the second is when providers would be subject to the potential 2% point reduction in the APU for failure to comply. So as it was clarified in the 2016 final rule, CMS expects new providers to begin reporting HIS data on the date noted in the letterhead of their CCN notification letter. So since hospices can't register for KEYS ASAP accounts, they need that CCN number first. So if the CCN notification letterhead is dated on or after November 1st, the hospice is not subject to any financial penalty for failure to comply with HQRP requirements. But that is only for the relevant reporting year. One important note is that the policy is tied to the date in the letterhead of the letter, not the effective date of your CCN, which could be different. We recommend that you save your CCN notification letter if you're a new provider so that you have proof of the date in the letterhead and proof of when the letter was sent to you. And as a practical note, I know CMS has found that hospices are highly likely to be non-compliant that following year when they're subject to reporting and the 2% reduction in their APU. So it's very important that new hospices learn the HQRP requirements and that they meet them. And there are trainings and useful information on this topic that can be accessed 24/7, 365 days on the Education and Training Library webpage, which is listed in the links at the end of this presentation today.
Thank you, Brenda. The next question is asking about exemptions. They ask, can you tell me about the exemptions for new or small hospices from the HIS reporting requirements? Brenda?
Sure. There is no size or newness exemption for HIS. All Medicare certified hospice providers are required to submit HIS data regardless of their size or the number of patients that they serve. But note that the HQRP requirements include both HIS and CAHPS. And so the hospice CAHPS survey does have both a newness exemption and a size exemption. And these exemptions only apply to that CAHPS requirement. And if you need more information about the CAHPS size exemption, we recommend that you review the CAHPS website information and look for the participation exemption for size tab that's on the left on that website.
The next question asks, I always thought we only had 14 days to submit the HIS. Can you clarify? Jane, can I pass that to you?
Sure. It is recommended, yes, it is recommended that hospices submit data within 7 to 14 days to be sure of acceptance by the 30-day deadline. The 14 days is only a recommendation, while the 30-day is a deadline to meet the timeliness compliance threshold of 90%. Hospice, HIS, admission, and discharge data must be submitted and accepted for all patients within 30 days of the event or target date. Remember, the act of submission does not equal acceptance. So you should be well appreciated for submitting your data well before the 30-day deadline. You are more likely to be able to address any issues to ensure your HIS quality data are submitted and accepted by the 30-day deadline. Thank you.
Thank you. Our next question is, can you just clarify again the differences between fatal errors and warning messages? Brenda, can you take this one?
Sure. So as we heard in today's webinar, the final validation report, or that FVR, provides detailed information about the status of the submission files. And it's this report that details those fatal errors and warning messages. So the warning messages alert you to inconsistencies or issues that you should be aware of or you may want to address. But they're only warnings because the issue was not severe enough to reject the record. So records with only warning messages are still going to be accepted into the database. And examples of warnings can include late submission warnings or inconsistent responses or dates, like we talked about. In contrast, those that receive fatal errors are not accepted into the ASAP system. So you'll definitely want to monitor that FVR report for those types of errors so that you can address and resubmit any rejected records and get those HIS records accepted into the national database. Remember, to meet the HQRP requirements, you must meet the requirement for both HIS and CAHPS, and this includes that you have your HIS and CAHPS data submitted and accepted in a timely manner. If you wait until the end of the time period to submit data and get fatal errors, then you run the risk of not meeting the requirements. So you want to definitely get your HIS data in well before that 30-day deadline in order to have time to make corrections that are within your power to correct. And more information about error messages and warnings are detailed on the HIS data submission specifications that are available on the technical information page for HIS on the CMS website.
Thank you. The next question asks, we had a patient who was admitted but later that day decided to revoke hospice. Do we still need to submit an HIS record? Joan, I'll pass this question to you.
Okay, yes. The answer is yes. His admission record and his discharge record must be submitted even if the patient revokes the hospice benefit or is discharged from hospice. Maybe it's important for us to go back over and emphasize when they must be submitted. So I'm going to kind of go through the points there that we want you to take away from this training. For the purposes of completing the HIS, a patient is considered admitted to a hospice when the following conditions are met. There is a signed election statement or other agreement or care for non-Medicare patients. The patient did not expire before the effective date of the election or agreement for care. And 3, the hospice made a visit in the setting where hospice services are to be initiated. All 3 criteria listed above you got to meet them for the patient to be considered admitted for the purposes of his reporting. Okay? Thank you.
I'll also pass this next question to you, Joan. This person asks, we have had several private pay patients. Do we need to submit an HIS on those patients?
Yeah, you do. Medicare certified providers must submit HIS records for all patient admissions regardless of the payer. So it does not matter what the patient's payer source is, or commercial insurance, no insurance, or Medicare. Providers must submit HIS and CAHPS data and meet the hospice quality reporting requirements based on all the patients that they serve. Thank you.
The next question is in regard to modification versus inactivation, and they ask, can you clarify again the difference between these two? And Brenda?
Okay, sure. So those modification requests are used to correct HIS records that were accepted into the KEYS ASAP system, but for some reason had a clinical error or a non-key demographic error. The inactivation requests are used when a record has been accepted, but either the event did not occur or one or more of those event or patient identifiers is erroneous. So one of those important identifiers like a patient's name or an identifier such as a Medicare beneficiary number or Social Security. And in the case of these key identifiers, those records would require inactivation first and then resubmission if appropriate.
The next question says, I discovered several HIS admission records that had been inaccurately coded back in 2017 by the person who was submitting the HIS for us. The errors were in the clinical coding and I attempted to modify the records. However, when I tried to send the modification, it was rejected. I know it is more than 2 years from the admission date. Is there any way to make this correction with CMS? Brenda, can you take that question as well?
Sure. So unfortunately, since so much time has elapsed, the answer is no. You know, the current policy, as we discussed, allows for submission of these records for up to 24 months from the assessment date or that target date. And this used to be 36 months, but it was changed effective October 1st of 2019. So this policy applies to any new, modified, or inactivated records. And the date by which providers do this affects what data is reported on Hospice Compare. So one important note here is that the calendar year 2017 data is no longer included in any quality measure calculations that are currently being displayed on Hospice Compare. And Hospice Compare, what they're displaying currently is Q1 2018 data to Q4 2018 data. So the ability to update those assessments would not affect your hospice's data on Compare at this point anyway. A great resource for providers in terms of public reporting and key dates is that there's a helpful table that can be found on the CMS HQRP website under public reporting key dates for providers. And I would encourage you to go to that, the website, and print that out for yourself.
Our next question is, what will happen if I try to correct a record that is more than 24 months old? Joan, I'll pass this question to you.
Sure. Sort of along those same lines, I guess, derivative of the question above, we have a policy where any HIS submission after 24 months will be rejected. So when we did the training earlier, we were talking about, the dates in which you can modify or activate. So the CMS policy for the HIS patient record submission was changed, as Brenda pointed out, in October of 2019, from 36 months to 24 from the target date, so the event date. So the policy change and deadline apply to new, modified, and inactivated records. So your submission would be rejected because it's beyond that 24 months of the target date. Thanks.
Brenda, I'll pass this next question over to you. This person asks, is there a penalty for submitting a correction more than 30 days after the initial assessment date?
Sure. So all the records must be submitted and accepted electronically into the CAHPS system within 30 days of that event or the admission of the discharge. Timely submission and acceptance of the records is a requirement, and it can affect your APU. But there is no penalty for corrections made after the 30 days as long as the record's been submitted and accepted within that 30-day deadline. So you can modify and inactivate requests, and they can continue to be accepted for up to 24 months. But the HIS data that are modified after the 4.5-month data correction deadline for public reporting will then not appear on Hospice Compare. So there is a period of time where you can correct and you can still make some modifications that will impact your results on Hospice Compare. So for more information about the data submission deadline, you can find it on the HQRP website. And again, information in the manual will give you some good examples about modifications and inactivations. And you'll find those references all at the end of today's presentation.
Our next question is requesting clarification of the reporting cycle. This person asks, we have incurred a 2% decrease in our APU for this current fiscal year 2020. When can I expect the 2% Medicare payment decrease to be finished? Joan, could you answer that question?
Yes. So our reduction in fiscal year 2020 is reflective of data from the calendar year 2018. So the payment reduction is a 2 percentage point reduction in your annual payment update only for the corresponding fiscal year. So remember, to meet the Hospice Quality Reporting Program requirements, you must meet the requirements for both the HIS and the CAHPS. This includes that you have your HIS and CAHPS data submitted and accepted timely. Also, I'd like to point out that there are trainings and education on this topic that can be found in the Training and Education Library, along with the best practices web pages on the Hospice Quality Reporting Program website. So access these trainings and related materials because they're there 24/7, 365. And another one I want to point out for you is there's another helpful reference there on our website, and it's requirements for the fiscal year 2021 and future reporting years. So we just posted this fact sheet.
in January of this year, and you can find it in the download section on the Hospice Quality Reporting Requirements and Best Practices website. And I'm not going to cite website to you because I know those are all long and kind of hard, but it is there again in the Requirements and Best Practices webpage. Thank you.
Our next question asks, we are trying to understand or make sure we are meeting the 90% compliance threshold. Which report is the best one to use? Brenda, I'll pass this question to you.
Okay, thank you. So sure, the Hospice Timeliness Compliance Threshold Report in CASPER allows you to check your preliminary compliance with that 90% compliance threshold. And specifically, this report displays the provider identification information. It gives you the number of HIS records that you submitted, the number of records that were submitted on time, and then it gives you the percent of HIS records that you submitted on time. So remember, not only must your records be submitted in a timely manner, but they also have to be accepted. So there is a timeliness compliance threshold fact sheet that you might also want to download from the CMS HQRP website, and it can be found on the HIS page under the download section.
Thank you, Brenda. The next person asks, you talked about the many different reports. Can you clarify again what they are used for? Brenda, can you provide clarification?
Sure. There are a lot of reports, so I know it's hard to keep track of, but there are hospice-specific reports in two main categories in CASPER. One is the hospice provider reports, and the other is the Hospice Quality Reporting Program. So the hospice provider reports contain over a dozen reports that can help you with tracking admissions and discharges, but they can also help to identify errors and find more detail in terms of any record or specific errors that you might be experiencing over and over. And then you can really figure out what's happening or why these errors are occurring. And that timeliness compliance threshold report is also located there under the hospice provider reports. So the second big category is a Hospice Quality Reporting Program. And this report category contains 3 reports, and these can all be run on demand, including the review and correct report. The other 2 reports in that category are confidential provider feedback reports. So these quality measure reports are intended to provide the hospice providers with feedback on their quality measure scores, and they allow the providers to not only view their national average scores, but also specify a reporting period and view their own quality data at both the patient stay level and the hospice level. Now, in addition, the HIS and CAHPS provider preview reports are 2 separate reports that are automatically stored in your provider's shared folder in CASPER. And these were made available starting in March of 2018. Now, these are not run on demand, but they will show up in your CASPER folder. Prior to each quarterly release of the data on Hospice Compare, hospice providers are given an opportunity to review their results during this 30-day preview period using these provider reports. And since these reports are provided to the providers after the freeze date, the hospices can't make changes at this point. It's too late to make changes to the underlying data. So it's important to submit accurate and timely data and to use those other reports to help you identify errors as you're going along and not wait until you're ready to see what's going to go up on Hospice Compare. So one reference, you can find a lot more detail on these reports in the CASPER Hospice Reporting User's Guide, which is on that Keys Technical Support Office, or the QTSO, call it, website. And again, that is listed at the end of our resource section for the slide deck we used today.
Thank you, Brenda. Joan, I will pass the next question to you. They ask, do the provider preview reports mirror what is going to be published on Hospice Compare?
Thank you. Yeah, they do. The preview reports, as Brenda outlined above, show what hospices what will be published on Hospice Compare. Or I also want to mention, a lot of times you're going to hear Successor website, because I think many of you are aware that we're maybe transitioning to a new website for Hospice Compare and all of our Compare sites, an agency-wide initiative. But yes, the preview reports that the providers receive does contain what will be published on Hospice Compare. Thank you.
Our next question is, you mentioned there will be a change in the key system. Can you tell us more about and be more specific about when that will happen? Joan, could you also provide a response for this one?
Sure. The key system will be changing to a new platform called the iKeys. Some providers are already using this new system. For example, Home Health has transitioned in January of this year. So for hospices, this change will not be in effect no sooner than at this point, it's going to be when the timeline is near, we're going to announce it, but I think it's calendar year 2021 that hospice was the last in the transition. Thank you.
Thank you. We have responded to all of the questions that we could answer today. We apologize if you submitted a question and it was not answered during the webinar. Some questions may require additional research. If you submitted a question that wasn't answered in today's webinar, it will be distributed to the appropriate help desks and subsequently posted to the HQRP requirements and best practices webpage as soon as responses have been drafted. Before we wrap up today's event, I'd like to thank Brenda and Joan for the valuable knowledge shared during today's webinar. We'd also like to let you know that the full version of slides, including the answers to the polling questions, as well as a recorded version of this webinar, will be posted, and we will send an email notifying you when and where those items have been posted. This concludes the HIS Submission Requirements webinar. Thank you all so much for attending, and enjoy the rest of your day.